My name is Ashley. I'm going to be your nurse today. I'm a nursing student, and what I'm going to be doing for you today is that I'm going to be cleaning and then also assessing your wound on your outer thigh. Now, before I begin, can you tell me your first and last name?
Sarah Kralik.
And also your birthday for your safety.
2/23/01.
Okay, and now before I begin too, are you comfortable? Are you experiencing any pain?
No, I'm not experiencing any pain.
Okay, and then do you have any allergies?
No, I do not.
Okay, and then before I also begin too, I did shut the door behind me for your privacy. So do you have any questions for me before I begin?
Nope.
Okay, so what I'm going to do first is that I already performed proper hand hygiene, so I'm going to begin. And then I'm also wearing PPE too because it does say you have a contact precaution for infection control. Okay, so now what I'm going to do is that I'm going to reveal your outer thigh right here, but I'm going to keep you covered. All right, so I'm going to do it like this. Okay. Does that hurt in any kind of way as I'm kind of moving the towel and bed around?
No.
All right, and then I'm also going to take a protective blanket here, just in case if any kind of drainage comes out of your wound, so your bed doesn't get all messy. I'm going to lift up your leg just a little bit here. Alrighty. Okay, perfect, just like that. Okay. So now what I'm going to do for this technique is called the push-pull technique. I'm going to remove your bandages, and then I'm going to assess and clean it too. So let me know again if this hurts you in any kind of way. I am going to be removing the tape. Alrighty. So, like I said, push-pull, push-pull. Still going. Does that hurt in any way?
Nope.
Okay. Alrighty, so what I'm going to do, remove the gauze. Now I'm going to assess what I see on your leg wound here. I see your leg wound is beefy red. It has some slight redness, no tunneling. I don't see any pus coming out of it. The surrounding area doesn't look red or puffy either. I'm going to dispose of this, just like this. And then now I'm going to measure your wound too. Now because I don't have any tape measure, I'm going to measure it like this from my device, from my gauze. So your wound here is about 6 centimeters. And from that length, that is 7 centimeters. Okay. Alrighty. Still experiencing any pain or anything?
Nope.
Okay, so now what I'm going to do is that I'm going to clean it. First and foremost, I'm going to set up a sterile field. I'm going to remove my gloves. And then I'm going to be making sure my package is not expired and it's dry, and it's going to be on a dry surface too. So I'm going to come over here. I'm going to pull it away from my body, like so, and make sure I only touch the outer edges and dispose of it properly. Kind of wiggle it out of here, making sure, like I said, not to touch any of the edge of the inside. Drape it in front of me, the 1-inch margin. Okay. I'm going to continue by doing the same method by dropping about 6 inches above my field. I'm going to be placing my gauze right here, filling that with solution here in a second. I'm going to be placing my irrigation tray pull against. I'm going to be placing the irrigation tray under your wound here to capture any kind of drainage when I do clean it. A couple other things here. My abdominal pad. And then my solution for cleaning. Okay, set that off to the side. Now I'm going to be putting on my sterile gloves, and then we can begin cleaning. Oh, actually, I've got some more supplies here. Alrighty, same thing goes for everything else, making sure the expiration date is valid and it's sealed and it's dry. I'm going to pull and place and take it out like this, making sure it's facing me properly. Going to unfold from the top and the bottom, and then pinch the sides, not touching the inside of my package. Okay, I'm going to put on the gloves now. Okay, I can adjust as needed. Dispose of this. Alrighty, get rid of this on my side here. Okay, now I can begin the irrigation and cleaning process. Pick up some solution here. Okay, trying to stay away from my sterile field. Now I'm going to irrigate your wound. Firmly putting it side to side. Okay. Alrighty, till the water runs clear. Okay, so then what I'm going to do is that I'm going to dry it, pat it from cleanest to dirtiest. Making sure I just dab it here. Dispose of the gauze. Okay. Okay, now I'm going to patch it up. Now I'm going to be applying wet gauze and then dry gauze. Going to be draining excess fluid out here. And placing the wet gauze like so. and then some dry gauze. Okay. And then my abdominal pad. Gonna be applying some tape here. Alrighty, we are almost done. Okay. Now I'm going to be signing it and dating it. Just like so. Alrighty, and that's how you clean and assess your wound.